Good evening, Facebook, and welcome to Wednesday Night Wellness Live. I'm Dr. Andrew Merrill here at Nightlight Chiropractic in downtown Orlando. And as we go into our 10th year of practice, and I think we're just about to roll over into our second year of these Wednesday Night Wellness Live videos, these are all about bringing you the best content that we get from our patients day in, day out, week in, week out. So we just celebrated our 10-year anniversary here a couple weeks ago as a clinic. And what I noticed was that we have seen just under 5,300 patients. So 5,300 patients in those 10 years, about 530 patients a year, give or take 2 a day, maybe just a little bit more depending on how many days per week we're practicing. And what I start to notice is some common themes in all of the questions that we're getting from patients and all the lines of questions that we're getting from patients. And so I started to distill them down into kind of records, tracks, things that I was saying again and again and again. And from there realized I needed to do these video series to help get you that information, because it's probably a question that you have or maybe had or one of your friends had or has. And if you knew the answer, maybe you could bring that to them. Now, the vein of these Wednesday Night Wellness Live talks is I'm picking a content or some articles and kind of distilling them back to you so that you can get some of this great information. If you ever have questions, feel free to reach out to me in the comment section. I look at these comment sections weeks and months after the fact. Also, these end up going onto YouTube. If you don't like the way that Facebook has these videos kind of outlined, you can always find them on YouTube. So tonight, and I always title these videos, right? I don't have to. Nobody else really sees these titles, but I like doing it. And tonight's topic is called Mixed Bag, because we're talking about 3 totally different ideas and jamming them all together here. So the first thing we're talking about tonight, and you've probably seen this video either on YouTube or on Facebook, is about the Y-strap adjustment. And if you don't know what that is, I'm going to kind of show you real quick the idea, because you're going to realize real quick that you have seen this video. So this goes around somebody's head, and then the chiropractor yanks real hard and then actually pulls the patient almost off the table. Have you seen that video? Has anyone out there seen that video ever? It's kind of crazy to watch. It looks so dangerous to me, this Y-strap adjustment where somebody is being just pulled along the table. But this is out there, right? This thing is getting millions and millions of views. And so patients come in and they want to know, do I do this Y-strap adjustment where I'm going to yank you across the table? And the answer is no. I don't do that adjustment, and I wouldn't let anyone do that adjustment to me. And there's got to be a reason why, right, Dr. Merrill? And there is a reason why. So first, it's not taught in any chiropractic school, right? There's no research to base this adjustment, this pulling on. This is just some kind of changed version of what is taught. What is taught in schools is a slight pressure using a pull, similar to traction, right? So if you've ever been to my office before, we do similar traction using similar type devices to help pull your neck and create some gentle axial traction that helps decompress the discs and the joints in your neck. When you do it very rapidly, the risk of injury becomes very real, right? So a ballistic stretch on muscles and ligaments and discs and even the joints themselves has a real risk of injury. Now, sometimes during these videos, what you'll see is the patient says, wow, there's an electric-like sensation afterwards. And that's not a good thing, folks, right? So I heard it chalked up as like years of tension and stress leaving the body by the practitioner. And that is just such cockamamie nonsense. What that is an injury to your nervous system happening, right? And it's very similar to when you hit your funny bone, right? Have you ever hit your funny bone on the desk and you're like, ooh, there's electricity? That's not a good type of sensation, right? That's not good for your nervous system either. And it's similar to when you're getting pulled across the table during this Y-strap adjustment. So highly not recommended. No, we don't do it here. No, I don't recommend that you do it anywhere. You can use a variety of other traction type devices that we've talked about in other videos, just not that Y-strap quick jerk on your head. Really, really bad idea. So what else are we talking about here tonight? We're going to talk about some pain creams, right? So recently I've been getting a lot of questions from patients, or maybe pushback from patients. So we carry a couple of different pain creams and topical pain things here. And patients always want to know which one is the best one, right? So I got some Cryoderm Heat here. I got some BioFreeze spray here. And I got some CBD pain cream here. So which one of these is the best? What do you think the answer is? Which one of these is the one that you need right now to make your pain go away and stay away? Well, as you can imagine, if you've ever heard me talk before, the answer is none of the above, right? These are all just alternatives to oral pills and over-the-counter medications that you can take. I do not recommend any of these over the next. I recommend whatever works for you and you think is best. Keep doing that because that's what you should be doing. But understand, it does not replace all the other things that we talk about, right? So still using ice, still making sure that you're stretching, still making sure that you're resting it and not adding more injury on top of what's already there. That is much more important than any of these different pain creams or sprays will ever be. So these are just an alternative to taking NSAIDs, over-the-counter non-steroidals like Tylenol, ibuprofen, Advil. Hi, Dr. Seaman. All of these things are just secondary and instead of pain pills, not instead of ice and instead of stretching and instead of all the other good stuff. So which one is best? None of them are any better than the next. They all do roughly the same thing. So whichever one you feel like is most useful for you, do that. All right. So third thing on our list tonight of this mixed bag is chiropractic safe for pregnant patients, right? And this is an important one because for a long time, we were seeing a lot of pregnant patients. In fact, at any given time, some of those 5,300 patients that we've seen over the past 10 years will come in with new pregnancy and new back pain related pregnancy. When I was looking through a lot of the research related to this, it's interesting because a lot of the chiropractors that are interviewed during some of the different research I was looking at say they don't have much contact with pregnant patients. And I found that very interesting because I do. For a long time, I was a chiropractor under a program called Mom Care, which is the Florida state-run program where when a woman doesn't have insurance, she finds out she's pregnant, she's immediately put onto Mom Care. Her baby is put onto state Medicaid so that they have benefits to make sure that we get quality care for pregnant women and for babies preterm. And I was a chiropractor under this Mom Care program, so we were getting all kinds of pregnant patients being sent through the doors to us specifically related to their back pain. In fact, I think we were the only chiropractor on Mom Care here in Orange County for quite a while, which meant that we had anywhere between 3 and 10 new pregnant patients per week coming through the doors that we were supposed to treat. Now, for the record, I don't have any additional training above and beyond my training during chiropractic school in treating this patient population. So the specialist training for this, relatively few and far between, hard to be found here in the city and in the county. But I don't think that you need that specialty care to treat pregnant patients, at least according to the research. So let's talk about some of that research, right? Approximately 50% of pregnant women experience back pain during pregnancy, right? And only 21% of pregnant patients report that low back pain to their practitioner, to their OBGYN as they're going through this. So relatively untreated. I think it's kind of maybe just an idea that we have, maybe just in this country, maybe across the world, that the back pain that comes along with pregnancy is normal and to be expected, and you're supposed to just be tough and deal with it. And that's not true either. So if you do have back pain during pregnancy, things can be done for it to help make sure that you don't have back pain during pregnancy. So there was another piece of research. These are a bunch of different research articles that I'm slamming together here, folks. If you actually want to see some of this research, just let me know. I'll link the articles into the comment section here. You probably don't. It's tremendously boring. But chiropractors reported that 72% of pregnant patients were likely to have benefited from chiropractic care, right? So few women reported the pain, but once they did report that they had pain, those under chiropractic care, 72% of them actually got benefit from that care. So those are pretty good numbers, right? In another different research article, again, what they found was that 31% of the 950 pregnant women that they surveyed used alternative therapies during pregnancy. Chiropractic was the third most common form of treatment sought, behind massage, which we also offer here, and then yoga, right? So yoga, massage, chiropractic, these are three things that we can do and use. And I don't know if Dr. Rita Seaman is still watching, but acupuncture falls right into that alternative therapy to reduce pain that's safe during pregnancy. So there's a lot of things that are really safe during pregnancy. Chiropractic is one of them. Now, what else is important about this besides just pain relief that you get from chiropractic care during pregnancy? Well, you get shorter labor times, right? This is important. If there's any women out there watching that have gone through this, having a shorter labor delivery time is really critical. That's important, right? Even just one less hour of going through that pain would be worth the time and effort, I would argue. But what they were finding in one of these research studies was that women who were in their first pregnancy ended up having 25% shorter labor time, and women in their second or more pregnancy ended up having a 31% shorter labor time, right? Their labor time was 1/3 shorter just by being under chiropractic care during pregnancy. That's crazy. That's amazing. This is huge. This isn't just, can we reduce your pain, your back pain right now during pregnancy? This is, can we reduce the pain that you're going to experience, which is probably considered the worst pain of your life? Can we reduce how long you're going to have to go through that? That's huge, in my opinion. Anyways, so there are some contraindications. So we're talking about, is chiropractic care safe for pregnant patients? And the tremendous overwhelming answer is across the board, yes. But there are some contraindications where it becomes not safe, right? So the contraindications would include vaginal bleeding, ruptured amniotic membranes, cramping, sudden onset of pelvic pain, premature labor, and placenta previa and ectopic pregnancy. So things that would, obviously some of those we know about, some of those we might not know about, but we always co-manage our cases with the OBGYN, really tremendously important. We are literally 2 blocks south of Winnie Palmer and Arnold Palmer Hospital, surrounded by OBGYNs here. We see a lot of these pregnant patients. If you know somebody who's pregnant who's experiencing low back pain, we're happy to treat them, send them to your local chiropractor there, wherever you may be, because they can help to reduce some of their low back pain during pregnancy and also their labor and delivery times. So if you're just tuning in, we went over mixed bag tonight, the Y-strap adjustment, where they yank on your head. Is it good for you? Tremendously bad for you. Don't do that. We talked about pain creams. Should you be using some of these pain creams? Which one is best? None of them are better than using ice and stretching and some of the other therapies that we talk about, but all of them are better than over-the-counter NSAIDs. And then again, is pregnancy safe for chiropractic patients? Overwhelmingly, yes. So as usual, if you have any questions for us, don't hesitate to reach out in the comments section. You can also always find me at Dr. Merrill at nightlightchiropractic.com. You can find all kinds of great information that we throw out there on our Facebook channel, on our YouTube channel, or on our blog, which is nightlightchiropracticonline.com. Thank you so much for watching here this evening. I look forward to seeing you again next week for another Wednesday Night Wellness Live. Be healthy. Have a great week. See you next time. Good night.